Terrific. So the changes are my vision has gotten worse. My right eye is very out of focus in the center.
And you're still the only special one in the family?
Yes.
Your parents are okay, right?
My parents?
Yeah, no problems in driving, right? Your parents.
No, my parents did not have trouble driving.
Yeah.
But I stopped driving last year.
So we are thinking of it. This is the Stargardt gene or another gene called RDS.
Mm-hmm.
But I think Winston do some DNA testing to find out. He's on the precision drive.
You have to log in for account because you can have access to
I think you log in.
Yeah, just log out and log in with your account.
You cannot search.
You don't have access with this login. No. The first one, yeah. Sing out and switch accounts.
I mean, maybe you can bring up the picture again too. Mr. Smith, so you can see the change. You guys just normal before, right? I think the previous prediction is that you can always just reading central vision will be blurry, but then it is always you can walk the steps and travel, do things by yourself. I think that's the previous prediction.
Do you think I'll be able to continue reading?
Reading cannot guarantee,
Mm-hmm.
but we can guarantee that you have independent. You will not need somebody else to take you around because of your vision.
Well, I've noticed,
Did you repeat it?
you know, there are lots of things I can't do that are becoming more and more difficult to do. Like elevators in New York drive me nuts because they are not backlit. You get in, I cannot see which floor I'm getting on.
You sure it's on the desktop?
Yeah.
Yeah, that's right.
Right.
And I'll open the drive. There's the file. Okay, let me take a look at you. Remember myself, it looks like.
Take a look at my.
Yeah, okay, I first.
Mm-hmm.
No. So you can see the recent file. Can you see the?
Internet here.
Yeah. But it will be in the ABC for Excel file, right? For all the ABC for.
Yeah.
And you're still developing the drug?
Yes, it's a phase two trial, right?
It's
phase 2 is just waiting for phase 2 is going to run one more year.
1 more year?
Yeah, so people have been out on placebo on a drug, and then data will be presented to FDA, and after that, then FDA will allow it to phase 3. We do not know what's the inclusion criteria for phase 3.
Yeah, I'd say about 6 months ago, Winston had me come in to take my blood for my RNA.
Yeah. Only one, right?
One.
They cannot find a second one.
I don't think so. I will check the crown.
How about RDS? Make sure it's the RDS negative.
Okay.
Okay, I'm gonna have you lie down a little bit. It might maybe reported before. So I think Winston is doing try to do some testing to see whether or not it really causes the disease. So you need to have two, but maybe that's why for you in terms of compared to all the other Stargardt patients, you are relatively better off.
Yeah, that I can still read with my left eye,
So
and I can still see. I can still kind of see on my left eye.
yeah, so you have two spelling mistake in the Stargardt gene, and but one of them is not been described before. So you try to so we don't know that's innocent by that standard, but based on how the eye looks like, most likely that is pathogenic. But we probably still need to prove it because it's not is a mutation that has never been. We have a lot of we have maybe 450 more than 450 Stargardt patients here, and then you look at international database that but your particular mutation, one of the two mutations because it's recessive, your parents are carriers, has not been described before in any place else in the world.
I was saying about 6 months ago, he asked me to come in to look up, take a
maybe-
blood test
maybe.
for my RNA because there was a woman here from the Netherlands
Yeah.
who was, and he actually sat down. I even recorded that. It was really great. It was explaining why I didn't really fit within your, because I have the one recessive gene. I didn't really fit within your group for your study.
Yeah, it has to be kind of a too well-established mutation, right?
Mm-hmm.
But,
And you-
but most Stargardt patients will not be able to read by the time they are in their by 20 something.
Yeah, I've
30.
seen.
So your mutation maybe is a good one. It's not good to have mutation, but it's a good one. Is very mild. But for any of the trial to go ahead, we need to show that they're pathogenic.
Now, about a month ago, I went to see Dr. Yanuzzi.
Yeah.
You know Dr. Yanuzzi?
Yeah. We should dictate the report to
Okay.
Dr. Yanuzzi.
And he said that, we talked about the fact that you were doing the drug
Yeah.
test, and also that you've been doing.
There's a couple other treatment. There's a newer drug called Acusera, but it's only phase 1. It's for people very advanced.
Mm-hmm.
Alkeus is phase 2 already, and one more year, if everything goes well, FDA may allow it to go into phase 3.
Mm-hmm.
And we don't know the inclusion criteria for phase 3. But even if you don't qualify, then after FDA approval, then any doctor can write it as a
Prescribe it.
prescription.
And you're also doing gene therapy, right?
Yes.
But
So there's a platform from Sanofi. That one has been going for 4 years, but they have not announced the result. And it would suggest to me that maybe difficult. They're still testing patients to see if treatment make a difference.
Mhm.
And then the other platform is about to start. It's called Nightstar.
Night Star.
Yeah, the same pharmaceutical they're doing choroideremia is now also they have a different platform, a different kind of gene therapy virus for compared to Sanofi.
Mm-hmm. But I should just expect that this will slowly degrade over the next couple of years.
Central vision, but I think you can always 20 years from now, other than reading, you should still can do most of the usual thing
Uh-huh. You think the reading will go eventually?
slowly.
Slowly?
Yeah. But the other for you a little bit difficult to predict, right, compared to other patients because you have a mutation that's not been described before.
Right.
So we don't know how this mutation, but probably mild because it's
Mm-hmm. Yeah, it's interesting to see, for me to notice the difference between my right eye and my left eye. Where I can still read and fairly well see with my left eye, but my right eye, it's just the central vision too. Like when I look at somebody's face, I can't have eye contact, but I see everything around.
Do you have children?
I do have a daughter.
Winston has blood from your daughter.
No, we talked about this last year, 2 years ago, and then I kind of got the message, don't call us, we'll call you.
This is follow-up for Smith Kenneth. Date of birth is November 8, 1946. The letter has to go to the patient. A copy of the mutation. Copy can go to Larry and Lucy. Follow up for Stargardt. Patient also show features of peripapillary sparing. Previous ERG testing confirmed the diagnosis of Stargardt group 1. We would like to repeat the ERG testing in the next few months. 2 mutations for ABCA4 was found. 1 mutation is in the pathogenicity is not determined. So we now try to look if that mutation affect the RNA processing in the blood. We send another report when the information become available. The patient currently LKS enrollment is completed, and patient does not fit the inclusion criteria for Acusera. This is on a dictation by patient Smith, SMITH. The data examination is July 3rd, 2018. So you get a summary also. Any other questions for me?
Did I understand you to say you want me to come back in a couple months?
Yeah, for the ERG test to make sure it's still good. Because last time was done in 2018.
The which?
2016.
The which test?
The electric test.
The electric test. Yeah. Okay, you'll have to give me some notice. I'm moving to Minnesota
Together with your daughter. Yeah, so you're coming back to visit New York.
to see you.
Not during holiday time.
Yeah, I thought we could have a beer.
Yeah. you like cold weather? You don't want to move to someplace warmer weather.
I'm from.
Takayashi?
Yeah.
I'm
Warmer
from.
weather?
I'm from Minnesota. It's not as cold as it used to be. Just like New York isn't as cold as it used to be.
You met Dr. Takayashi and
Hi.
Dr. Takuti. They came all the way from São Paulo. Warm weather.
Brazil, yeah.
My wife's
Is
Brazilian.
Oh, really?
My wife's Carioca.
Karaoke.
Yeah, so that's the interesting thing, taking her to Minnesota. But not really, because when she landed in New York 45 years ago, she said, man, I'm not going to be miserable for 9 months of the year. I mean, you're from Sao Paulo, but Rio is even,
Yeah.
you know, like it is now.
Like it is now.
Oh, this is like a winter day in Rio. I mean, really, we would only go to Rio in August, and that would be like, you know, in the 70s. You know, you go to the beach 2/3 of the time.
2/3, yeah.
And then, I mean, I can't even imagine what it's like in, you know, Carnival, you know.
Rio is hotter.
Yeah.
Oh,
than São Paulo.
well, I think, yeah, because Sao Paulo's inland and it's a little elevated.
Yeah.
You know, Rio is like, what, similar to, I would say, Mexico City in terms of where it is on the,
Altitude,
First time Dr. Takuti saw snow.
yeah.
Yeah.
First time.
You can see more in Minnesota.
No, that's enough.
Snow.
yeah, it's funny that you may not remember there was a movie called Bye Bye Brazil. Might be before your time. But one of the things that was a circus troupe would go into the perform, and one of their things was they would create snow. Now, like the civilized countries of the world, Brazil has snow.
Has snow, yeah.
Actually, it was a very funny movie. It was a circus troupe that was trying to stay ahead of television because all the little villages were, everybody would get around the TV. They didn't want to go to the circus anymore, and they did these performances. So anyway, my wife loves,
Can we get
she loves the cold more than me, I'd say.
Correct. Yeah.
Blood?
And then maybe Winston see what happened to the RNA from 6 months ago.
Talk to him.
Yeah.
And
Any other question for me?
congratulations, you know, for you know, Brazil won yesterday.
Yeah.
I'm sure you all know, we all know that.
Yeah.
Belgium.
I hope so. Oh,
In
what?
the World
Brazil
Cup.
against Belgium.
Yeah, yeah. Yes,
Yeah.
next game, yeah.
That gets, oh yeah.
Yeah.
And So, we're all still smiling.
Yeah, we're doing well.
We don't talk about 4 years ago.
Yeah, no.
Okay,
German.
German, yeah, lost.
Oh, man.
German